Linda, a lot of details coming out from the Premier's address. Perhaps let's begin with the reasons behind why the hospital is now being closed for 7 days.
All right, Ayanda. So the Premier is saying that this is a precautionary measure, of course, to ensure that everyone is safe inside the building. As you might have heard earlier on, that not every patient has been evacuated out of the building. He says he's been able to walk through the passages and the hallways of the hospital, and it seems as though there is smoke that has entered into various parts of the hospital. Now, as a precautionary measure, of course, they'll now be shutting down the hospital for about 7 days. He says that they don't want to close it rather for 3 days, because then they might have to come back and extend the suspension or the closure of the hospital. So with immediate effect, then any patient who was supposed to be getting healthcare services here at the Charlotte Maxeke will be redirected. They're ordered not to come to the hospital as it deals with containing the fire. We're also hearing that the fire services have been able to put out about 80% of that fire, so 20% of it is still remaining. So from where we are as well, there were a couple of moments ago we were able to see some of that fire that is still inside. We're hearing from the firefighters themselves saying that they are busy pumping in water to ensure that they contain the fire in perhaps one area.
And let's speak about the water issue, Linda, and it's become exactly that. Interesting that firefighters had actually explained that part of the difficulties with trying to contain this blaze from yesterday was because they couldn't access enough water. The MEC of Infrastructure Development is there as well, Tasneem Mundara. She couldn't give clear answers about why that's the case.
Indeed, and that is why I had to ask for clarity in the end of that briefing, Ayanda, because those are the reports that came out, that there was no water or hydrant infrastructure in this hospital, which could have perhaps assisted in putting out the fire. So she then explains that the firefighters have had to drive to a different area, which is not even 5 kilometers, she says, to come back and, of course, start to put out the fire. So those are the issues that are coming out. I mean, when you look at the importance of reacting on time in order to be able to contain the blaze, we hear that it started yesterday morning, but it was reignited late yesterday and has gone on till right now, Ayanda. So those are some of the issues that needs to be addressed when you speak of the infrastructure in this particular hospital, the integrity. We've been speaking about this, where now, it is indeed said to be compromised because one of the floors is said to have caved in. So it's caved into that specific storage facility, which means then that they will also have to wait for the engineers to come and assess the damage and now be able to say, okay, you can go in and put out the fire completely. So we're hearing of a lot of storage facility, or rather of a lot of medical supplies that have been damaged by that fire. But of course, if there was water nearby, they probably would have been able to take it out on time. But she also speaks about, an assessment that has been done in order to try and better, the infrastructure in the hospital. She makes reference to the time when these hospitals were built, saying that they are old buildings, they are old hospitals, and at the time there wasn't a need for hydrant infrastructure in the hospital. That is why then today, in 2021, the firefighters had to go outside and drive for at least an estimated 5 kilometers to access this water, to come back and therefore start, putting out the fire.
Yeah, part of the concern, Linda, or part of the curiosity will be around the cause of this actual fire. Interesting to learn from the Premier that at the time when it broke out, apparently there were 2 guards and 5 staff members who were present. There's nothing being said about foul play. In fact, we're being told foul play is being ruled out. But we also don't know really what happened because these individuals are yet to give an account of what they saw.
Indeed, Ayanda, they're hoping to find leads from those, 5 employees and 2 security guards who are working on that day to perhaps provide clarity. But it's also quite interesting that the Premier says they are not, suspecting any foul play in this issue, because when you look at the circumstances of the Carltonville Hospital, where a similar incident happened, there is no mention of the trend and what they've been able to pick up, and whether it's something that they need to really look into. But of course, those investigations will then reveal as to exactly what could have happened. You might have heard I asked about the issue about the employees who were suspended and whether they were part of the employees that were working here. We understand that those were suspended for participating or for the destruction of property during a strike in 2018. So the CEO then saying that at this particular point she's unable to say whether some of those employees were part of the employees that were working, the officials that were working yesterday. So it then now places our hope on the investigation, which will then be able to reveal what could have happened, where could things have gone wrong. Is it an electrical fault, or is there foul play here?
Yeah, what we know for a fact, though, Linda, is that the Premier has advised Gauteng residents not to bring anyone to the hospital, announcing an immediate halting of services, and in also speaking about a call center to be set up to try and inform the relatives of patients who are there where those patients are actually going.
Indeed, I mean, you can only imagine the frustration and the panic that the families of those who are sleeping in this hospital, those who are meant to get medical help in this hospital, are feeling right now. In fact, earlier on I had a discussion with the spokesperson of the Gauteng Health Department, around how relatives have taken this issue, and she says that some of them were coming immediately when they heard of the news of the fire. Some of them started coming to check up on their loved ones, but they were advised to go back home as the authorities or the firefighters are still battling with the blaze. So that evacuation plan and moving of the patients will then determine whether some of these, or who has been affected by it, and which families then need to be notified, because she really speaks about people that really were concerned as they came to the hospital, and really one can only imagine what they may be feeling like, having also not to deal with the stress of having a loved one sick in the hospital, but also the potential or the risk of them being caught in the fire.
Yeah, absolutely. One can only imagine what they're going through. Linda Mnisi, plenty to unpack. We'll continue doing that, no doubt, throughout the course of the morning and also the early hours of the afternoon. Let's leave it there, at least for now. Our Linda Mnisi live to us there from just outside Charlotte Maxeke Academic Hospital. In case you missed it, the big story is that that hospital will be closed now for about 7 days as a precautionary measure. Quite an unprecedented move, considered just how sacrosanct really hospitals are, not at the very least in the context of a global health crisis. And that's, of course, that's what makes this an incredibly important story that we'll continue to follow for you, no doubt, throughout the rest of the day.